doing great today. I'm Shalja from Simpliwow Services. So Simpliwow Services is an AI-enabled digital ecosystem platform that helps connecting the industry experts and the service providers associated with this dynamic industry of cosmetics and aesthetics. So we all know that everyone is going through a tough time during these COVID-19 situations, right? So the question in everybody's mind is, when will COVID-19 pandemic end? When will India reverse the growth graph after, severely affecting due to the COVID-19? And what are the implications that can be drawn post COVID-19? So there are a lot of questions in everybody's mind there. And as per the global statistics, though all the industries are badly affected, there's one sector that has severely affected, that is the healthcare, and especially the dental sector. And as you all know that the dental doctors who are at the highest risk must take stringent safety protocols and precautions for its clinics. And today we have with us our esteemed panelists who will be sharing their knowledgeable insights about this dental sector and what are the implications and what is going to happen in the next after the COVID-19. So in the panel we have today Dr. Aniruddha, who is from the Toothpix Dental Healthcare located at Jitendra, Bangalore. So he is an entrepreneur by passion and a dental surgeon by profession. He has started Toothpix Dental Healthcare as a dedicated center to provide quality dental care at affordable cost to enhance the dental health and its increased awareness among the people. We also have Dr. Anitha Alageshan, who is from the ZEN Dental and Healthcare located at Koramangala, Bangalore. She has completed her master's in orthodontics and she's currently pursuing her PhD with over 12 years of experience in dentistry and over 3 years of experience, her own private practice in Bangalore. Her philosophy has always been to treat each patient as an individual by creating a smile that is unique to them on their face. So we also have Dr. Jitendra Revamkar, all specialty dental clinic located at Basaveshwar Nagar, Bangalore. With over 27 years of experience and specializations in implants, he started his clinic with a single chair way back in 1999 with an intention of providing quality and affordable treatment. So today he has grown to a 6-chair multi-speciality dental clinic encompassing all the dental specialties. We also have with us Dr. Rupa Jitender from the All Specialty Dental Clinic located at Basaveshwar, Bangalore. She has completed her MDS in 2006. With over 20 years of experience, she has specialized in root canals, that is endodontist, and has a special interest in the cosmetic dentistry. So welcome all our panelists.
Thank you.
So today we are going to have this discussion about the dental sector in the COVID-19 now and the future. So there is an urgent need for the dental sector to revive or come back with some important precautionary measures in the interest of patient safety and also the safety of the medical staff. As we all know that the dental surgeons are at high risk of contracting and transmitting the coronavirus, how is the dental sector going to tackle this? So Dr. Jitender, can you just enlighten about this particular aspect of it?
Yeah. Good afternoon, everybody. Am I audible enough?
Yes.
You are.
Okay. So most of the dentists, we are all in the same boat, of course, not only in India, but all over the world. And the pandemic is, like some people said, it's a black swan event. Something which nobody has seen. It comes once in a lifetime or nobody's seen in their lifetime at all. And the problem that most sectors, including especially dentistry, is facing is we are one of the worst hit of all, because the whole world is talking about social distancing and putting a mask on your face. And we dentists have to work in that area. We cannot distance ourselves from our patients, and we have to work in an area which can get us and others more infected. So it's a very tricky situation for dentist, and all of us are including the assistant staff. And then finally, if any one of us get exposed to the COVID, the problem is then we take it back home. And then we risk that our families and our family members, elders, children, we risk infection for them. The point that I'm trying to make here is that COVID is not something which can be taken very lightly. And being in the situation as dentists that all of us are, we have to make sure that we have to be at utmost precaution in terms of try to see what all advisories have been given to us by our respective dental organizations like IDA, and we are also trying to follow what American Dental Association is trying to advise us. And we have to see to it that we take care the maximum. As it is, dentists do take a lot of care. Our hygiene standards were, as it is, quite high. Dentists, we were sterilizing, we were disinfecting our clinics, but now the biggest channel is going to be what we call as aerosol. As a common person will understand, whenever a dentist uses a drill, that generates a lot of the air and water mixture that comes out of the mouth. That is supposed to be in the air in the clinic for up to 3 to 4 hours. And that sits all over on all the furniture, on all the equipment, it will be there. And that can be highly infective if we treat a person who is positive, who's COVID positive. So the biggest challenge will be taking care of aerosol and how to eliminate, minimize aerosol, and how to sterilize, disinfect the clinic after that. Yes.
So that was a really nice insight what you have shared, Dr. Jitender. So unlike any other industry, as we all know that the dental sector is significant changing in the coming future. So as all of you understand that the outcome of this pandemic leading to a very uncertain future for the clinics, with the delay in opening of the clinics for the next few months, a big hit in the revenue of the clinics. So Dr. Rupa, can you just tell us, like, is there a ray of hope or a silver lining to the situation? Or what is the positive aspect to stabilize the situation in the dental industry?
Okay. Good afternoon, everyone. Thank you for having us on this panel discussion. It's one of its new kind now, I guess. We all know the viruses was always there, but the biggest threat with COVID-19 is it's become a pandemic. And, the way it is going on infecting people, it's like, it's not just the dentistry, like you already, the question involved, all other industries are hit as well. And, 4-6 weeks of lockdown is something which none of us had experienced. So getting back to work is definitely, it's become a task for everybody as to how to start. But like Dr. Jitendra already said, the main norms that the WHO said or anything, we've been hearing about COVID-19 since December 2019, ever since China, Wuhan was hit. And social distancing, basically wearing a face mask, hand sanitization, and disinfection of constantly touched surfaces. These are the normal protocols which have been set, and that is what holds good for most of the industries. But for dentists, we are getting into the battlefield. If we take COVID-19 as an unseen enemy out there, and everybody else is taking precaution against a war with an unseen enemy, we are going right into the battlefield. We are at the LOC, you can say. So it's not going to be easy. We all have to be well equipped. Well equipped in the sense, as dentists, we were always following all the protocols. We knew what is infection control measures are. We knew what is, we were more keen on, focused on fighting with bloodborne infectious diseases like hepatitis and HIV. These were the ones that were really drilled into us. So I guess as dentists, especially in India, we were more concerned about instrument sterilization. All of us had taken clinic disinfection and other things a little more lightly. I guess in terms of personal protection, I guess we were just wearing an apron, probably a head cap, and the mask is what all we thought was essential and that should take care of us. But now with this new pandemic, it's become very stringent. So I guess the silver lining is, I guess we can consider this is going to enhance the quality of treatment that we're going to give it to our patients. We are not going to be all the mass practice of dentistry that was going on, wherein we could see 10 to 15 patients, up to 20, 30 patients a day, depending on the capacity of the clinic. In a practice like ours, where we had 6 chairs and we had the 5 associates working with us, we had in-house specialists who were working with us. So it was easy for us to see the number of patients in a day, but it's not going to be so now. So it's going to be cut down to more quality patients, where we are going to limit the number of patients we are going to see. That is how we can probably consider social distancing in our practice, where we don't call in too many patients at a time. We schedule an appointment, have a conversation, have a telephonic interview, consultation with the patient, see what they need to be. So only call in patients who need really emergency care, not really an elective procedures. So it's going to enhance the quality of, in a long run, if you have to look at the positive aspect of it, it's going to enhance the quality of treatment. The kind of time they're going to give to the patient is going to be better. We are going to be looking at doing more treatment for a patient in one sitting, rather than just doing something in 10, 15 minutes and packing them up and sending them back. Because whatever we do, we are going to be more focused. So I can only take a positive aspect of better treatment to a patient, a better quality of treatment, and a more stringent measures that we all are going to do in terms of sterilization, in terms of clinic disinfection, basic hygiene protocols, and taking care of ourselves in a much better way as compared to what we were in the previous days.
So we all know that for a safe dental practice, quality treatments require huge investments in following the protocols to ensure minimum risk to the patient, as Dr. Rupa just mentioned about this. So at the same time, it is equally necessary for the proper process management, like by training the medical staff with the following necessary compliances that are required. So what is the role of the dental professionals to gain back the confidence of the patients if they want, after this situation gets back at least to a normal, by minimizing the spread of this infection? So Dr. Jitender, can you just enlighten on this?
Yeah, so one of the main things that in terms of gaining back the confidence of the patients is they have to be told and they have to be sure that they will be taken care very well in the practice. Just for example, yesterday I had a patient and I was working on a procedure of just cementing something for a patient, which was long due for the past 2 months. And another patient, a lady walked in with her daughter, again, overdue orthodontic checkup. And she did not even want to sit there for 5 minutes. She didn't want to sit in the waiting hall for 5 minutes because the patient that I was working on, his one attender was sitting outside. And she came and she literally made a fuss about, I don't want to sit here for long, how long it's going to take. So patients will have this kind of difficulty and this kind of anxiety will be there into walking. First thing, coming into the dental clinic. Second thing, getting a procedure done. So we have to educate the patient. We have to tell them, we have to show them that we are taking the utmost care with the latest of the protocols, whatever has been advised by all kinds of boards and all kinds of advisories that have come in. We have to make sure that we are well equipped in our clinic is well equipped, our staff, ourselves and our staffs are well trained, and the patient should understand and make the patient understand that we are taking all the precautions and they are in safe hands. It's, of course, like everybody is talking about teleconsultation first. So once that teleconsultation happens, we have to make the patient understand that, yes, we are going to take these precautions. You are supposed to take these precautions before coming in, whatever mandatory things, and like patient should not come, as far as possible, avoid 2 people coming in, just as if possible, unless and until it's a geriatric or a pediatric patient, just one person should come in, and maybe, even make the other people wait in their car or outside the clinic. Don't let them come in except the patient. So if you tell them that we are taking all these precautions and you are supposed to take all these precautions, maybe they will get some confidence. They will think that, yeah, fine, I am safe in this clinic. You have to make sure, see, you will have your regular patients, they will be coming, but you have to make sure that they have that anxiety levels are less, because I have seen at least 50% of the patients who have walked in the past couple of weeks that have just opened the practice for consultation, they have very high anxiety levels, and they've literally come only in severe pain, or any kind of, only in emergency patients are coming in. So the most important thing is you have to communicate to your patients that yes, we are going to take care of you and we are well equipped to do that.
So now, talking about even the technology and the scientific advancements that are emerging as a future of medicine, as Dr. Jitendra just mentioned about the telemedicine and the teleconsultations that are going to be the future of the industry. So all thanks to COVID-19 again, that the technology is actually emerging. And especially the telemedicine, which is predicted to show a boom in the near future. So how is it going to restructure the dental industry? So Dr. Anitha, can you just share some insights about this?
Thank you, Shailaja, for that question, and good morning to everyone, especially to my friends, colleagues, and students who have managed to join in on a Saturday early morning. So to answer your question, Shailaja, while it's nice to think that we can treat patients remotely while sitting at the comfort of our own homes, presently it does come with its own challenges. Two questions come to mind with this. Can we do teledentistry practically, and what's the scope for it, especially when it comes to our own practice? To this, I say, when the opportunity knocks, open the door and say, welcome to it. We have been hearing about teledentistry even when we were doing our bachelor's, and this is a great time to put it into practice. So how and where we can use it practically during the current scenario? Say simple tools such as smartphones and laptops with good webcams should be our new best friends, which I'm sure has always been. So firstly, we could use these tools to follow up on patients whom we saw just 2 months ago. It's always a nice thing to go back on our immediate patients and say, hey, is everything fine with you? Is there any sensitivity issues where the filling was done last month? Or in my case, being a braces specialist, this can be used as a way to remind or threaten the kids to wear their elastics or any appliances given to them, and check if they are able to maintain their oral hygiene as instructed. And in fact, for most of my aligner patients, once the trays are handed over to them, follow-ups happen mostly virtually, even before this pandemic situation came across, when they are sitting all the way in Dubai or Australia. Now, secondly, where we can use these virtual tools is follow up on existing old patients. Just like how we send a monthly newsletter, why not we say hi and check how's everything going? And once again, remind them that we are available for any type of dental emergencies for their close friends and family members. I'm sure they would appreciate this gesture. And thirdly, for new patients, like how Dr. Rupa and Jitendra beautifully put it across, instead of asking them to directly come to our offices for a consultation during these times, why not initially do a virtual consultation and check whether in fact it is necessary for them to come all the way to our offices, and then give them the solution which may help them to resolve it sitting at the comfort of their own homes. And finally, there is the artificial intelligence, which is the crux of teledentistry these days. When it comes to my field in orthodontics, AI with the help of algorithm has been used efficiently in predicting how an individual's smile will look like, or what will be the final position of the teeth at the end of the treatment. So the part is these things can be done without the patient stepping into our offices. So this has been a great boon for us orthodontists to do the treatment plans more efficiently, and the treatment results have become much more predictable. But again, going back on all these words, we must remind ourselves that the conversation that we have between the technology and treatment should be one of a balance. How can dental professionals work to utilize new technology, research, and methods while still making sure that the nature of care delivered is centered on patients and their needs, and not some algorithm where you end up losing the individual's unique character? So during the present scenario, it's great that we use technology to do virtual consultations and see the most vulnerable dental patients safely in their homes, thereby eliminating the risk of infection. But again, we must remind ourselves that technology is not the answer. However, technology can be used as an enabler towards a better patient experience and better patient engagement. Over to you, Shailaja.
That was really indeed a very great insight that you have shared, ma'am. Now, as you said that, you mentioned that the technology can be like the best friends of man, post-COVID era. So, do you see the role of technology in better management of the clinic-patient relationship, like the AI-enabled emotional AI, what Dr. Anitha has mentioned, the telemedicines and the online consultations, what Dr. Jitender just previously mentioned. So, how could these contribute for a safe dental care in India? So, Dr. Aniruddha, can you just show some insights about this?
Yeah, definitely. Good afternoon, everyone. And as Dr. Anitha had mentioned about how she very brilliantly put the orthodontic aspect of telemedicine, I think as a preventive dentist, I would say we have an opportunity to penetrate into areas that would otherwise not be able to enter into, like the penetration of healthcare system into areas like in the rural centers or maybe in a city like Bangalore where traveling becomes a bigger issue. A lot of things can be solved by teleconsultation. However, like she mentioned, it should be an adjunct to the treatment that we are providing. It should be something that we look into in terms of building a relationship with our patients. So patient and the clinic relationship can be developed using telemedicine in a lot of cases. I think most of us are doing that right now in terms of consultation, or even if somebody calls us on an emergency, we first talk to them over the phone. We do a video chat, we understand the photographs, we try to understand what's going on, and then get into the next step of asking them to come down to our clinics, because safety of our staff and our safety and our family safety is also priority in condition like pandemic with COVID-19. Now, when we talk about artificial intelligence is basically it's to solve the real life problems that we face in healthcare, or it can be in the field of agriculture, manufacturing, so many other fields as such. But we have so many novel, programs that are used to detect cancers, that is used to kind of innovate the way we work in the hospitals or in our clinics. That kind of innovation is there. But what can an artificial intelligence do for us, and how artificial intelligence is important is because artificial intelligence can do a lot of administrative work for us, a lot of clinical work for us, and a lot of training and research which can be done through artificial intelligence, where we can mostly concentrate on what is needed importantly to improve on the situation what we are facing right now. That is a pandemic situation. But as dentists, we are like Dr. Jitendra very wonderfully mentioned, as dentists, we had already enabled ourselves with a lot of infection control protocols. And we have been treating patients with HIV, with hepatitis, with a lot of contagious diseases. And even the word PPE, what everybody is talking about right now, is not a new thing for a dentist, because if at all we would do surgeries on a patient with HIV, PPE was a normal thing that we use. I'm sure most of the doctors agree with this. And as far as artificial intelligence is concerned, we kind of have a classification of it. It can be descriptive, where a dermatologist could use an artificial intelligence where he kind of looks at the photograph and kind of gives a provisional diagnosis for the particular condition. Where, because as much as a dentist, even an ENT, a dermatologist or a physician, all of them are equally affected because of the kind of spread the COVID has, and because of the status of novel that it has right now. And you also have this predictive artificial intelligence, which is used in a lot of penetrative healthcare, that is regarding public health centers where there are not enough clinicians to take care of. So to get a fair idea as to what artificial intelligence can do there is to understand what the symptoms are, send it to the bigger center, and then probably advise them accordingly, or probably conduct a camp in that particular area, depending upon collecting statistics, etc. And also the very controversial AI is the prescriptive one, where the treatment protocols are generally taken care of. But I think a lot of industries right now, like for example, I think there's a program by the Philips Innovation Campus, I believe. So they have a very wonderful program which has been done to diagnose tuberculosis through chest x-rays, which has reduced the cost and which has reduced the time taken to diagnose the problem. And why I'm using tuberculosis here is because even if you look at the R naught of tuberculosis, it's slightly higher than COVID, but then still we know that tuberculosis is also something similar to COVID, where the spread is concerned. It is also, as a dentist, we can get tuberculosis even through saliva. So that's the kind of, and aerosols could also spread tuberculosis for us. So we have been taking care of ourselves in a particular way, but artificial intelligence should be an adjunct to what we are doing right now without losing the trust of what dentists do. And I think there's a lot of innovation happening, and I believe Karnataka government has spent more than 2,000 crores since 2016 to 2020 on artificial intelligence. And I think there is future for us over a period of time with a lot of research and applicability, and bringing the investor, bringing the innovator and the practitioners together, bringing the gap closer is going to help in implementing these things in our private practices, because private practice is not just about going to the clinic and coming back. It's a business that we deal with. It involves money, it involves risk of health, it involves a lot of dependent workers for us. It's a lot of things for us. It's not just bread and butter, but also bread and butter for a lot of them who are dependent on our clinical practice. So I think in future, AI should do really wonderful with further research. That's what I feel, Shailja.
So as rightly said, that prevention is better than cure. So we all need to actually follow this, considering the pandemic situation is, until the situation gets normal, right? So, so now over to you, Dr. Rupa. How dentists can learn and contribute at the learning edge of this pandemic global situation, like the various parameters that could include the expertise, exposure to the latest dental practices, and the hygiene, what we just spoke in the previous assignment, and equip the dental fatality in the industry. So how do you think the industry should overcome to this particular hurdle?
Okay, now when we talk about this pandemic issue and knowing about the anxiety levels that everybody is having about this pandemic, people are even scared to sometimes just walk into a mall or walk into a shop where there is more footfalls and things like that. So when we know all these things, we have to we as dentists, when we know that we are at bigger risk of catching the infection, if more than considering the spread of infection, I guess what we are really looking at here is we not catching the infection ourselves. So we need to have more protocols in our practices to prevent catching infection, like being dentists, like how we spoke, we already know about the personal protection equipments that we're using, which are going to be more rigorous. We have, it's not just the mask and the face shield, we have respirators coming into the pictures. Earlier we had something like just a mask or a surgical mask was sufficient for the dentist, but now we are all having to shift to N95. We're having to shift to a respirator. We're having to involve something like a fumigator into the practice so that the aerosol is taken care of. We may have to have the air purifiers coming into picture. So there is a huge investment that is going to come into the picture now. It's not going to be just a regular practice that we had. So taking into consideration for all these things, how many of us will be actually able to invest in these new equipments, and for how long? Because it's not just you just invest once and you take care. They have their regular maintenance, they have their regular service. So the pandemic, the COVID-19 is not just going to disappear one day. It's like, we just have a date for a lockdown to be lifted and for things to get back to normalcy, but we don't know when the COVID-19 is going to go away. So this is going to definitely push the date of a reopening. We are not going to be starting to function at the earliest, like how we planned. It's like, come June, it's like, although there are a lot of guidelines that is coming from the DCI and from some prominent speakers that, don't do any aerosol generating procedures till the end of May at least. But we cannot be sure from June we can just start off just like that. We need to have more protocols in our place, which will make sure that whatever aerosols that we are generating in the clinic will be taken care. We have to make ourselves equipped in such a way that, the patient treatment plan has to be scheduled in such a way that between each patient, we have at least some amount of a time left in the operatory so that the aerosol settles down, so that the disinfection can happen. And but there's so many, for everybody, all of us as dentists, we all have studied the same books. We all have learned the same subject the same way. But where we have put things into practice is based on our own experience into it. So this itself is a new experience. So as and when we start working, I'm sure each one of us, based on our own atmosphere, based on our patient inflow, based on our area of expertise, we will get into a way of functioning which is best suited for ourselves and for the patients who come into our practice.
If I can just come in, what I plan to do is, since I have multiple operatories, I plan to keep one operatory totally for only aerosol procedures and have just minimum 1 or 2 cases in that operatory. Like maybe have one patient in the morning and just leave a few hours for fumigation, or now they're talking about ultraviolet light for sterilization of the room and fumigation, and maybe invest in a air vacuum suction and all those things. And I'll have my consultations in the other operatory. That is what I'm planning to do now.
And,
over to you, Shikha.
Shailja, can I add a point here? Because like wonderfully mentioned by both of them, and also for the new guys who have started off their practice now, maybe a new practitioner who started a practice just a month before the lockdown, or maybe just 6 months before the lockdown. This could be a great revenue kind of a scare that the doctor would have. But I believe right now it's time for us to collaborate, become associates with each other, and collaborate and work so that the heavy investments are going to be distributed, and it is going to make the quality of practice better. And like Dr. Jitendra said, like when one chair is being used only for aerosol, when he has 6 chairs there, every chair needs to have a patient. So how do we do that? We need to have an associate working for us. And rather than having multiple clinics popping up everywhere, collaboratively working together is going to be more beneficial for the patient, one thing, and the quality of the practice is also going to improve. That's what I feel is going to improve the kind of work that we can deliver in the field of dentistry. I mean, Anitha and Dr. Jitendra, Rupa, you can just add in if I'm wrong in this aspect.
That's fine. You're right. You're right. It's more collaboration is definitely required, and we should collaborate in whatever way possible among as dentists with our colleagues. In our neighborhood dentists, we should talk to
as a family, dentists as a family, and try to help each other and fight this COVID-19 at least till the time things get back to normalcy, which doesn't seem to be happening.
The new normal. Get back to the new normal.
Correct.
Very nicely said, or Dr. Rupa, Dr. Jitendra. So now, as Dr. Anitha has just a few times mentioned about the changes that are going to actually take place, like the technological changes, the advancements, and the various use of the technology, how it could be the best friend of man. So what are the other changes or the challenges you foresee in the operation of the clinics, like post-COVID-19? And how are dentists going to gear up these situational conditions, Dr. Anitha? Can you just help our audience understand better about this?
Thank you, Shailaja, for that question. So according to me, change is the only constant. I do not really see it as a challenge, but rather a welcome change, in fact. So this is the time, like all the previous doctors mentioned, to equip our practices with better infection control measures, which is one of the high priority things needed for any dental clinic to be operable these days. So even though the immediate future does not look that peachy, I'm going to be optimistic here again and say that in future, quality would matter than quantity, which was rightfully said by Dr. Aniruddha as well. So oral healthcare would be at a premier point and something to be taken more seriously, similar to maintaining your overall health. I'm sure the doctors in the panel will agree with me that during these, we have got numerous calls where we have not been able to attend to our patients' need at their will, which is usually what's expected of us. So now more than ever, because of the new investments that the practitioners have to make with regard to their protective gears, the fumigation protocols, changing the designs of our own clinical setup, fewer appointments each day, public will start to notice the importance of oral health, which they may not have taken seriously earlier. And like what Dr. Rupa mentioned earlier, having fewer appointments means providing quality treatment and help improve the doctor-patient relationship. So previously we used to jump from one chair to another almost mechanically, but here we do have a chance to build upon our relationships with our patients as well. So now coming to the practicality about what we need to foresee for the next 6 months, we need to start somewhere. I mean, dental practices are not going to be closed forever. Protecting our patients and staff need to be the most important thing. And I personally am following a 3-phase plan, which will help us prepare better for the immediate future. So this 3-phase plan is basically planned for the next 6 months. Phase 1, which is for the coming first to the second month, is for the soft opening of our practice, which we are already doing it right now as practitioners in Bangalore. So here we start seeing only emergency patients who need immediate care. Say, for example, patient with a fractured tooth, a severe toothache, or presence of a swelling. So use this downtime along with these emergency cases to stay current about new safety processes as set by our councils, associations, and our government. Then choose wisely on what to invest in. I'm sure everyone is going through this right now, where everyday dental dealers are coming up with some new inventions regarding infection protocol. Just yesterday, I read a meme about a dental pen. Apparently, you need to autoclave this dental pen as well, and they were charging us like bonkers for this particular new invention. So do your research of the product that are advertised and see if they actually serve the necessary purpose rather than blindly investing on them. So once again, choose wisely. Next, evaluate how many appointments you can fix in a day. Like Dr. Jitendra said, because our chairside time will be considerably increased and we do not want unnecessary crowd in our setup, it is imperative that we time our appointments from one patient to another with huge time gaps. Then get our team members, that is the receptionists, assistants, and our resident doctors back to work slowly but safely. Take the necessary consents, and documentation is key during these times. So document everything, especially these times, because we are doing most of it is through virtual consultation. And finish up the cases that had to be stopped halfway through due to lockdown. For example, say a delivery of crown or a bridge. Continually research and seek out any funds available for small businesses. So this is a tough one to follow through because of the conflicting information that is currently available for us. But if we can get any help, that would be great. Then finally, during this phase 1, what we can do as well is contact vendors or dealers or even our clinic owners to provide for payment relief and better financial terms for us to ride this particular wave. Now coming to phase 2, which would be for the 2nd to the 3rd month, where you do a soft to medium opening of your practice. So during this time, that is during the 2nd and the 3rd month, use the morning huddles and end of day debriefs mainly with your assistants and resident doctors to refine protocols that fit our patient and team's need. That is regarding the setup needed for a particular treatment, avoiding unnecessary cross infections, and constantly educating them about the significance of hygiene during these times. And put what you learned in phase 1. So because now we have got a lot of downtime with us, of course, we have gone through several journals, several articles, and so on. So put what you learned in phase 1 into action, mainly regarding the infection protocol. Next, slowly increase the workload methodically. That is, slowly start with your monthly ortho follow-ups. Any cases that have been previously treated only with medications can now undergo proper procedures with either RCT or tooth extraction and so on. Then start with the preventive procedures such as fluoride application for kids, cavity restorations, along with regular cleaning. Because again, we must remember that during these times, even patients will be having a fear psychosis to visit our practices, and maintaining their oral health may not be their top priority right now. So it is at these times that you see more of routine, simple cases becoming more of an emergency situation because patients are ignoring or not willing to come for the treatment at an earlier stage. So we may in fact start seeing more patients who may have to undergo root canal, which could have been previously avoided with a simple filling, or more of gum disease because they have not been taking care of their oral hygiene regularly. So this can be done during the phase 2, that is the second and the third month in the coming days. Now coming to the phase 3, which will be from the third to the 6th month, which like Dr. Jitendra said, will be the new normal for us. Again, you can start with continuing to evaluate your new costs for the extra time spent and the necessary equipment that you have purchased for your setup. And accordingly, we can increase our fees for the treatment and start billing out accordingly. And so for the next 6 months, if you can make profit out of all these things, that's great. But the main business goal should be to cover all of our overheads. So that should be the main business goal. So these are some of the practical ways in which we can gear up for our practice in the coming 6 months. And over to you, Shailaja.
Thank you so much, Dr. Anitha, for the lovely insight. So now we have already spoke about the technology advancements, the kind of hygiene routines, the kind of process that we need to follow for taking care of the patient's safety. So now over to you, Dr. Aniruddha. What is the role of the government and the medical bodies in supporting the dental industry with certain preventive checks or the measures that will in return help the industry to combat this situation in India?
Yeah, to start off with that, as dentists, first of all, this is for all my colleagues. Do not panic. Don't panic, because we are not in a situation where we can be thrown out of our own clinic. We are not in that kind of a situation. Unlike another kind of an industry where there is an uncertainty of jobs, there's an uncertainty of being given your salary and etc. We have our intellectual investment that we have done for a lot of years. So therefore, that one thing should not let us panic over a lot of things that is happening around. And of course, whenever there is a panic, me being a fellow in the area of pandemic, I always believe that, people tend to panic because of a lot of media output, a lot of things that's happening around them. And, a lot of people who want to do service for the society. Because of this, there's a lot of panic that is created. So now as dentists, it is very important for us to communicate with our patients and tell them not to panic first. Do not panic about the situation, because there are patients, for example, in orthodontic cases, when they don't see us every month now for past 3 months, when they're not seeing us, they suddenly panic. They may have missed their appointments earlier, even without any notice. But right now, because of COVID, they're not able to come to the clinic and they're panicking because they're staying at home right now and panicking about their tooth not moving and so many other things. And this is a very, very, empathetic situation for us to understand. And this is what we as dentists should understand, that we should show some empathy towards patients. But now, who is going to show empathy on the dentist is what the question probably I understood as, if you're talking about government or medical establishments. If you actually look at the websites of WHO or CDC or even IDA or DCI, they've been regularly updating us on this regard about what we need to do. There was a very regular update, and fortunately, this was, I think, the very first time a lot of these bodies have been active about the regulations that have come up for practice and other things. And also, like documentation is concerned, what Dr. Anitha mentioned earlier, our organizations, our authorities have now published certain consent forms that we need to take before we start off with our treatment with patients, because it is a necessity. Because we wouldn't, if there is a carrier who is coming into a clinic, we would in no way be able to diagnose the disease of COVID or any other such symptoms if there is a carrier who is walking into a clinic. So we need to kind of do a proper screening, take the required precautions as far as ethics and law is concerned. We need to take the proper precautions. And like I mentioned earlier, the government has invested a lot on research. It's invested a lot on research, especially in the area of artificial intelligence. And there's a National E-Health Authority, which is also called NEHA, where the authority is mainly based on how it can help healthcare. For example, I think a lot of us have heard of cardiac surgeries that are being performed through artificial intelligence, and a lot of hospitals collaborating, a lot of departments which are collaborating in the area of artificial intelligence. But this is a very high cost research that's happening. And if you're talking about artificial intelligence and research with government, there are a lot of funding that's happening. And especially I'm very proud that Karnataka is doing really well in terms of artificial intelligence and how the research process is going on. I'm sure Resolute AI is going to know better about this kind of AI research that is happening. But other than that, what is the accountability that that our government has? We are shut down. What is the accountability? Who is accountable for this? And what kind of relief we are going to get? There are MSME organization where dental practitioners can register. I mean, if a lot of colleagues didn't know about that, I think it's a good time to go and register with MSME, because dental practice is part of MSME program. You can have it in your small, micro or large scale organization. It's very important that you need to know what are the programs that the government has already given us. So I individually do a lot of practice management courses in my clinic. I have a lot of young dentists coming in and who wants to start their clinic working with me only to understand how the business works. I think that's not the right thing. That should be inculcated in the education system itself. They shouldn't be coming out as a dentist and then come to another dentist to understand business. They shouldn't be doing MBA with me in the clinic rather than learning new techniques and new skills which are available. We have been seeing a lot of webinars on surgical areas. We've been seeing webinars on how to do telemedicine, what can be done and things like that. But what is the important aspect of how we run our business? I mean, let us bring the fact right. Anybody in the healthcare industry or anyone in the area of dentistry, we all have done this because of our passion. We have done this because we wanted to become dentists. Of course, we understand the service aspect of it. We understand the oath that we have taken. But yes, along with that, it comes to our bread and butter as well. So what are the aspects that we can cover up in that particular area? We need to understand what is being provided. So I request everybody to kind of update yourself with what the government is releasing. Probably we may not have it in the newspapers, but there are a lot of websites that provide information. Like if you go into Udyog websites of our government, you will get to know where dental practitioners are based. And if you're a member of IDA, then you have certain banks that give you loans for a lesser interest, and they have a better financial plans for dentists because you're a member of a particular organization that itself is authenticating you without other collaterals. So it is very important because like we know, we have a lot of investment to do. Dr. Rupa had mentioned about so many gadgets. First of all, dentists are working with so many gadgets. We have evolved from tactile measurement of apex in root canal system to apex locator over a period of time. So all these advancements come with cost, and that's why dentistry is expensive to an extent as compared to maybe general practice of medicine or something like that, because of the kind of investment that we have. But understanding what government is doing and educating ourselves, and it's not just educating ourselves about new techniques of doing things. It's also important that you understand how to run your own business. So I think that is where a lot of dentists lack capability in, to find out where to search, what to find out. I think as doctors who have knowledge about these things, I think we should share it with other doctors. And like we mentioned earlier, we collaborate, we find out what solution that we can create for another dentist who would want help from another dentist as well. So these are the aspects that the government is doing right now. But also it's very controversial to say that, we are completely 100% secure and things like that. It's very controversial. I don't think we are 100% secure in terms of safety and things like that. Our revenue is going to come down. It depends on the size of our clinics. It depends on how many clinics we own, and how many doctors associates are there, and how many staff we are paying salary and stuff like that. So all this is going to be changed, like the new way of practice, like Dr. Jitendra mentioned. A new way of practice is going to come into picture. And I think the government has to work a lot on preventive programs as well, so that this is going to help the dentists. It's going to make our job a little easier to convince patients about the importance of health. So although oral cancer is one of the largest killer amongst the cancer cancer industry, what is happening is the awareness is so less. The awareness of it is so less. Only 13% or 13 to 17% of public health centers are working all over India. So we have another, around 83% of potential in terms of dental healthcare as well. And no healthcare policies from the government has a special emphasis, like GDP that is allocated to healthcare is only meant for healthcare. It doesn't specifically mention oral health separately. So if it is 1.2 to 1.7% of GDP on healthcare, then you can imagine what kind of percentage is going for our healthcare organizations. So I think a government should really understand and collaborate with a lot of dentists who understand and find a better solution. And we as dentists should understand and find out who is accountable for these things, and find out medias to understand the whole aspect of where we can get financial stability from, where we need to register, how quickly we need to register, and what can we do about securing our businesses, which we have started with passion. I mean, I don't think like Dr. Jitendra is stepping into his third decade of practice. So it's going to be more like it's more like part of a person's body. The clinic is going to be an extension of your body, and it's not possible. Even if you're practicing for 1 year, you've started it with passion. So you cannot just shut down the clinic and walk away because something came in. But we will, I think, overcome the fear of COVID. Like Dr. Anitha mentioned, we should open in phases, and the government should support us in terms of how the opening takes place. And this phase is very, very important in terms of how government should help us, and how state government should help, and how the central government should help us with, financial support.
If I could just add here, like rightly said by Dr. Aniruddha as well as Dr. Anitha, we spoke about, Dr. Aniruddha mentioned about the government has to step in for the preventive measures. And we spoke about how the clinics can open up in phases and, at least try to meet our needs by in the next 6 months before the new normalcy can set in. So having considered both these points, it becomes really critical, because with all these things, for the next 6 months, the dentist really having to struggle to make their ends meet. It's like, to cover up the business expenses that we have, the establishment that we have, there is no further support. It's like, imagine 40 days of shutdown is like literally nil. And we will have to support people who are still dependent on us. And there are many clinics which are running on the rental incomes. So that's all considered a huge loss. Apart from that, the cost of the treatment is going to, the additional investment that we are going to put, the mask, which is costing 30 to 40 rupees, the surgical mask, if you're shifting to wear something which costs 400 to 500 rupees, it's all on to go on to pass on to the patients. So apart from the quality, though, if you look at the positive aspect, the quality of dental treatment is going to improve, but at the same time, it's going to be at an increased cost. As it is, the patient consider the dental treatment to be on an expensive side without understanding the reasons behind why they are expensive. So it's going to get more expensive from now on. It's definitely not going to come down. We are only looking at the cost escalation. So the prevention, if the government steps in taking more preventive cares for the patients, it's going to be really, really helpful, especially for the people who are not in affordable class. It's not going to be easy for them to walk into any clinic for that matter and try to expect some treatment for them. It's like, they will have to depend on organizations which are run by the government so that they can get treatment for their emergency services also. So there's a huge responsibility which has to be shared by the society, from we as dentists, as well as by the government organization in making sure that nobody is suffering out of this pandemic. It's put everybody's life out of balance, not just as it's like, even people sitting at home, their lives is turned upside down. So in all aspects, all the lives are affected, but we have to make sure that as a society, we all come together as one and make sure that the suffering is reduced, and we try to come out of it as amicably and as, in the best way possible.
And I also want to add another point over there. In fact, if you look at the insurance coverage on healthcare, dental health doesn't include in the area of medical insurance. There's a very petty amount of 5,000 or 7,000 rupees that's being covered if you have renewed for 3 years or 4 years. But I think the government has to look into dental health insurance as well, because it's one of the main, if oral cancer is killing a lot of people in the country, and the dentists are treating, and a lot of trauma that is happening because of road traffic accidents where oral and maxillofacial surgeons are working on, why not include dental services under medical insurance as well? Because that's going to make the patient's life easy as well. The kind of treatment, and it's going to be easier for us to deliver quality treatment when the patient is secured about, and the patient is confident that he can afford a treatment. Like otherwise, any one of us, we always, as private practitioners, we don't get insurance from companies. We get insurance from our own pocket, right? We buy our own insurance packages. So I think insurance companies have to look forward and think forward and bring in dental insurance into practice. And I think at the earliest, so that it's going to be easier for the patients as well. Because just like how we have seen a backlash in our practices, they've also seen a salary cut. The IT industry has done salary cut. A lot of them have lost jobs. A lot of them are not sure about their future and things like that. So this is going to help. Insurance is also going to help in a way to improve the kind of practice that we do and improve the quality. And quality practice should be the key aspect of what government focuses as well. Like I don't mind government doing a good audit on clinics, but a good clinic with good clinical practice, sterilization protocol, all these things need to be checked, and insurance should be provided to the patients so that it's going to be easier for them to afford dental treatment in future.
Thank you, Dr. Aniruddha and Dr. Rupa, for sharing this valuable insight here. And to continue here, Dr. Aniruddha, what would be your priorities now and later on?
See, all these days we had patients walking in anytime they want, or anytime we fix an appointment, even if it is just for a checkup or maybe just a follow up, just for a discussion, patient discussion. I think right now I'm using a lot of technology-based interaction. I'm doing a lot of video calls with my patients where they require a kind of support in terms of counseling about maybe instructions to be given post-surgery, or maybe follow-up or medication management for that matter. There are a lot of confusion for patients as well. When they get back home, suddenly they get confused as to which tablet to take at what time and how and things like that, because health literacy in our country is very low. So the kind of communication that we do is very important. And I also see that there was a question asked by somebody as to, in technology, which aspect I would use first in terms of digitalization. And in clinical area, I think I would look into the area of patient-doctor relationship development, which is very essential right now, because they may not be able to access us as much as what they would do before, because I wouldn't be able to get out of my PPE and come into a non-sterile area outside the clinic and sit down with the patient and talk. So maybe I may have a video call with the patient whenever I'm not able to do something like that. So that would be my first aspect. And also, I think I will collaborate more. I will bring in more associates with me who would want to set up a clinic but cannot afford to do that. I would want to bring them together under one roof and probably look that as an opportunity to improve services for our patients as well, because we can bring a lot of specialists together. We can bring a lot of them who are good at different work together. So I think Dr. Jitendra will have a better insight on that as well. And I think as dentists, we should unite now and come together and start a better industry henceforth. I mean, rather than grieving over the past, let us use this as an opportunity to advance ourselves in technology in terms of practice quality and overall management of our clinic, because we are not trained in management, we are trained in clinical science. So let's make this an opportunity to understand how businesses can be managed better and make it more profitable. Yeah.
Dr. Anitha, would you like to add on to the same question that we just spoke?
Yeah, so I think Dr. Aniruddha rightfully said, that this is a time to invest on ourselves. Again, I will keep this short and simple. So being cautious is important, but not being paranoid at this time about the situation is very important. So now is the time to bank in on all the knowledge sharing sessions or webinars that have been making the rounds. But again, too much information also can leave one confused. So pick and choose wisely. That would be one of my advices over here. And finally, I will end my session by saying is when we stop learning is when we stop growing. So thank you everyone for listening to this session. Over to you, Shailaja.
So Dr. Jitender, how about you? Would you like to again add up to this?
Yeah, the first thing I would like to say to all dentists and all the panelists here and everybody, with folded hands, please take care of your health first, because jaan hai to jahan hai. We have to make sure that like the airline industry, everybody, we all used to love traveling, but now it's all shut down. So like always in the airlines, they say, put your oxygen mask first and then help the person next to you with the oxygen mask. So if you are healthy, if you keep up your immunity, make sure you keep your immunity at a high level, your family, your assistants, and then you will be able to take care of everybody. Finances will come and go, problems will come and go. This will also pass. That's all I have to say.
And I would like to also put a point here saying that, please don't panic buy things that come on your WhatsApp groups. There are a lot of sellers who are sending in messages on so many things, and it's expensive. So don't panic buy anything right now. Wait for some time. Don't rush to open your clinic with all the latest gadgets, and that's not going to work, because you will realize that it's going to be a waste if at all it's not going to work for you in future. So don't panic buy anything. Understand how your practices are open in the phase one, that like Dr. Anitha mentioned. Understand your practice, understand yourself better, and then invest on things that you need to invest. Rather than buying everything one shot, it's going to be really expensive unless and until you have loads of money to spend on these things and make it very fancy. But otherwise, please be very careful when you're buying things, when you're investing on new gadgets, because see the efficiency, see what is required, because today it may be COVID and in next couple of months there can be something else. God forbidden, we don't want to face anything, but we should understand the reality. Sorry, I cut through Rupa and had to put this point.
No, that's fine. Actually, COVID is enough. We don't want anything else. We don't want to look at, it's like, at this moment, we're uncertain about when the COVID is going to go. So, yes, I guess first thing we have to do is let's not panic. Dentistry is going to rebound, and like you said, let's all be optimistic that it's going to become better. We are only making our services better. We are only looking at patients' understanding as to why dentistry is expensive the way it is that they consider. So there is a lot of positive things that we look at if you want to at this moment, instead of panicking over the issue. I guess the only concern right now is the delay in opening, because of the aerosol that is being generated. We cannot function without aerosols in our clinic. We can only do minimal, which is not even be sufficient to sustain ourselves. So it is only the delay that we're looking at right now. We don't know when the guidelines will come for us to be able to function with the aerosols the way it is. So that is the main concern right now. But once when we are able to function, it's only going to be a better dentistry. It's going to be a little not more of a personalized dentistry than the mass dentistry that we were providing in most of the clinics. And like you said, I guess it's time for most dentists to come in together and make a standard for ourselves instead of having multiple levels of practice, private practice that is going on. So I guess it's a right time for us to use this as an opportunity to create a standard where we can only look above from that standard than going further down. So I guess this is the message that we all have to take home, and all the best to all of us.
From Rupa, who's an endodontist, aerotor is her bread and butter, and aerosol is the one thing that she always needs to depend on. So I think we should really take her word, because that's where her industry works. That's the biggest thing that the endodontists do. So yeah.
There are guidelines that we can use electric motors instead of the aerotor, but there are guidelines says use the micro motor. But I'm sure if I use the micro motor, next patient wouldn't want to come into the operating themselves, not because of the aerosol or any
trauma that they go through.
Just the smell would actually repulse them. The patient would just walk away and they would want to come back the next day or something like that. So it's not actually easy to just stick to the protocols that are coming according to the guidelines, although they could be a protocol just to contain the infection. So there are a lot of things, and I'm sure each one of us will develop our own way of coming out of it. But whatever happens, I guess one basic standard is something which we have to establish right now in the field of dentistry, which we feel is missing right now, especially in our country like ours.
So thank you so much, everybody, for sharing this. So we have a question from one of our audience. So I'm going to read it. What kind of technology support clinics and dental hospitals might need immediately to deal with the pandemic to ensure the well-being of the patients and staff?
If at all, it's okay. The basic stuff itself with respect to technology is please connect with your patients. Don't stay at home and not connect with your patients. Use whatever social media technology that you can use, whatever you can connect with, So connect with your patients, make them feel that they are safe in the hands of dentistry, and let them not panic, let them not get carried away by what media and other platforms are showcasing. Let them get first-hand information from a dentist himself, first thing. Second thing is you could add in a lot of infection control measures, which are affordable initially, start off with evaluating and auditing your clinic and find out what you need to update and upgrade in your clinic. So that, I think, is the first thing that you need to do for the safety of your patients and staff, and the safety of yourself. In fact, like sterilization process, are you following the wet, dry, and the other techniques of sterilization? Are you following it in the right way? Are you disinfecting the clinic the right way? So use that and make sure that you can upgrade your clinic initially to start off with.
So we have one more question. Technology is always considered a good to have in various countries, is becoming a need, according to which critical areas of digitalization can help us?
Because I spoke about artificial intelligence here earlier, there are equipments that are available now in countries which can afford in the West, where the patient's face is just scanned and the reports are ready. And also, if you see, there are a lot of artificial intelligence that's used in controlling the chairs, or as simple as your Alexa that you have. If you ask Alexa to open the X-ray number so-and-so of a particular patient, the Alexa is going to open it on your computer. So that's going to reduce a lot of you touching the computer and touching a lot of other things, and it's going to make the work a lot simple. So I think invest on basic things like automation, like Alexa, or automations which will help you out with respect to controlling your patient management and patient appointments and the time that you take to do the treatment and things like that. Yeah.
We have one question from Dr. Rashi Jaiswal. Does mixing sodium hypo in water did any help in aerosol infection?
Yeah, if I can take that. Sodium hypochlorite is supposed to be very effective in this particular virus control. So hypochlorite is used, should be used in all levels, including in your booster bottle that we use, but it has to be kept to bare minimum as much as 0.1% or something like that. I can get back with the exact number, because it will corrode your tubings, and then it can also cause some frothing in the mouth if it is at a higher concentration. So it has to be at very, very bare minimal concentration of 0.1%. And of course, we all know that the guidelines have come that we have to scrub surfaces with hypochlorite diluted solution, and you can ask the patient to rinse with hydrogen peroxide also before the procedure. So yes, hypochlorite is definitely going to be used a lot more in dentistry, not just as a root canal irrigant, but for a lot of other things.
We have one question from Dr. Nishant Shetty. How do we decide what is right? Some IDA and DCI guidelines conflict, and also some senior practitioners have very different opinions.
Can I take it, Anitha, or do you want to take it?
Yeah. Go ahead, Aniruddha.
I think Dr. Nishant, I can see you here. So the thing is, I think we have been evolving into evidence-based practice all over, right? So I think we have to slightly tweak into experience-based practice. And as we grow in our practice, we also become senior practitioners in terms of understanding how practice is run. And we have education and knowledge of what is required. And if it is something to do with legal aspects, I think, yes, we need to follow it according to the aspect that the authorities have provided. But in case if it is an opinion of somebody that, you have to use a particular thing and if nothing else works, I don't think so. I think we need to analyze and understand what suits our practice the best. What do we do more of aerosol cases, or do we do more of orthodontic cases in the clinic, or do we do surgeries in the clinic? So all these depend on how we practice. So therefore, the IDA and DCI protocols which we have to follow legally, I think we should follow it according to what is the norm. But as far as the opinions and the conflicts of the senior practitioners, I think we should let it be, because we have to understand what best suits our practice. Because in Anitha's case, probably she will be doing more of ortho herself because she's an orthodontist. So maybe she may not be producing as much aerosol as another dentist in the clinic. So the protocol itself will be different. And I think over a period of time, we have to develop evidence-based protocols or experience-based protocols to enhance the quality of our practice.
So Aniruddha, you were absolutely right about it. So I think it depends, Dr. Nishant, it depends upon what is the field that you practice in as well. For example, I'm an orthodontist, but Dr. Rupa is an endodontist who is seriously concerned about the aerosols that they produce because of a procedure. Us being orthodontists, mainly focusing on ortho patients, especially the monthly follow-ups, which barely take around, say, 15 to 20 minutes without any aerosol producing procedure. We are at a much better position, say, when compared to endodontists. So I think, fine, it's great that we look into these IDA and DCI. But again, we must remember that these are just guidelines that are provided by these associations. And like Dr. Aniruddha mentioned, we ourselves are senior practitioners and we must go ahead with what we know best and suits our practice better, and go with the evidence-based dentistry that we have in front of us, Dr. Nishant.
Just like to add, it's like, apart from just being concerned as an endodontist, it's not just the concern about the aerosol that we produce, it's also the immense pain that the patients will be in at this time. If you said the most emergency that happens in a private dental clinic setup is the endodontic procedure. So imagine having to postpone that endlessly is going to be something which is not going to be very pleasant for the patient. So it's not about the guidelines that is given by the IDA or the DCI that we have to follow. You look into both the things, but pick and choose what suits the best for you. It's very clearly said that dental pain, acute dental pain, is one of the emergency protocols that we have to look into when the patient is having. So you again see if you can give a symptomatic relief with the medications and some prescriptions, and avoid starting the procedure for some time. And if it works, that's very good. Otherwise, then just excavate the caries and do some palliative treatment, see if that works, and then go to the next step. Again, avoid an aorta, instead use an electric drill. So there are protocols given by all the both the bodies, which are good, and we just have to pick and choose what suits that particular scenario for that particular patient in our practices, and that's how we have to go ahead about this.
So, any more questions? The
I think
audience.
there's one question. It is something which I picked a point on Alexa. So there's a question that says, and finally, Alexa will replace the step of teleconsultation one day with all the data they gather. In fact, coming to artificial intelligence, again, I think Sanjay is going to be very happy because I'm talking a lot on artificial intelligence today. The certain barriers in artificial intelligence is that one is your cultural issues, trust issues with system. Most of the patients trust you as a human being. Your cognitive skills are trusted. Also defining, acceptable behavior, because see, Alexa doesn't listen to me in my clinic. Alexa
I think Alexa became angry.
Alexa got upset.
Some connectivity issues that Dr. Aniruddha faced. So, any more questions our audience would like to ask our panelists? You can just drop a chat there, or you can ask directly to our doctor.
I think we have Dr. Aniruddha back.
Am I audible?
Yeah, you are.
So I think these are the regulatory clarity that we need to get into for that particular question as far as Alexa is concerned. And definitely, I don't think any technology that comes in is to replace our post or position as a dental surgeon in the clinic. It is basically as an adjunct to our practice. Any technology that comes in, it's an adjunct. Like X-ray is an adjunct while doing root canal. Because otherwise it was taught to be understood with tactile sensation, if I'm not wrong, Dr. Rupa. It evolved as a tactile sensation, which evolved into X-ray, and it evolved into apex locators. So technology shouldn't be considered as something that is completely going to replace our position as doctors. I think that's a wrong perception.
As a dentist practicing for more than 2 decades now, I'm very bad at technology, and I just love to get my hands dirty the way it is to be put. But yes, we have to be careful. But yeah, technology definitely, but you have to get on.
It can only be an adjunct. It cannot replace. It cannot replace. Or anybody.
Yeah, and Nishant, for that last question that you asked, I think we need to suspect and respect every patient who comes into our clinic anymore, because that's something I saw or I read in one of the articles, or I saw it in some webinar, because I'm so confused with the number of webinars and seminars that are happening all over Facebook and WhatsApp these days. So I believe we need to suspect and respect patients, and we need to tell them that we are following the particular protocol in a very respectful manner. I think that's going to help us in improving our practice style as well.
In fact, the ADA specifically says that we have to suspect every person as a carrier of COVID, and we are not looking at, in fact, according to ADA, they're not looking at preventing the spread of infection. They're only looking at protecting themselves from infection. So that is what the ADA guidelines are mainly focusing at. They're telling all the dentists, just make sure that you and your office personals are not catching any infection, and everybody who walked in is already a person who's infected with COVID. So that is how we are actually been asked to look at. But I guess in Indian scenario, if we go by the numbers that is being projected with just 75,000 infected individuals, it will be difficult for us to take it for granted that everybody is infected. But the way we have to protect ourselves is by looking at everybody as infected. But at the same time, we have equal responsibility to make sure we don't spread infection among the patients.
Definitely.
Could I just, because there's a lot to type, okay. So I'll just tell you what I went through. It was back in the middle of April when a couple of patients, so I'm also an orthodontist. In fact, most of you might not know, I'm Anitha's student, Dr. Anitha's student, once upon a time, yeah. So what my doubt was, somewhere in the middle of April, when everything was under lockdown, we had a couple of patients whose root canal treatments were stuck, and there was a patient from Britain who was under ortho treatment, who was very doubtful that the flights might open up and she might have to travel back because she had just come down for treatment, and she had come down for treatment on 19th of March, and I told her just wait for a day, and the next day the lockdown was announced. So she was stuck in India for another 16 days, and you can understand, every day I would get a message saying that I need to go back to Britain. Why don't you do this, or at least do multiple appointments? And Britain being the place from where there was the spread was at a high rate, it was a little. So what happened is I decided to get PPs. When decided to get PPs, I looked through the norms and everything. All the dentistry norms from DCI to IDA say 75 to 90 GSM PP is safe. And I was very, very okay with it. While there's still a confusion on the cost of the PPE because the same GSM is there for 200 and there's for 3,500, there was a little confusion, but I was still okay with this. I try to understand what are the guidelines that water doesn't seep through for 24 hours. I did my own set of sampling because I thought we all stand for responsible for ourselves, and me especially for the other doctors who are working in the clinic. I did the sampling myself. Okay, when that was the Citra SITRA, that is the South India textile sampling, which they say that even if you put water on the PPE kit, keep it for 24 hours. I kept it for 36. Water doesn't seep through. The PPE was very good. During this course, I came across something else. The surgical protocols were completely different compared to dentistry. Okay, and especially more than the surgical, what struck me was the ICU protocols. There, the GSM that was recommended for PPE is 170, and with the 170 GSM PPE, the doctors were told to not go closer than 1 meter to the patient, and they're supposed to treat a patient for only 10 minutes. Okay. In the contrast, if we are suspecting every patient to be a COVID carrier, in dental practice, there is even in orthodontics, there is being an orthodontist, 10 minutes, it might be one of the fastest orthodontists who would change the wire. But otherwise, every procedure of us would take at least 15, and I think in endodontic cases, it goes up to 30 to 45 minutes with a 75 to 90 GSM. This thing, I do really understand there's no problem to the dentist as such, but probably being a carrier, because that patient might contaminate this thing to the next patient, and the doctors and the cleaners, we cannot be as safe. So I again got confused, because somewhere they're telling us 75 to 90 GSM is safe enough. Somewhere in the other streams, they're saying 170 GSM and still don't treat the patient for more than 10 minutes, stand 1 meter apart. So I did understand that we all stand responsible for ourselves, and we need to put our education, our understanding into practice. But I'm still looking at, is there something on those?
One thing, the ICU protocol that you saw is the people who are already treating a patient who is already infected with COVID. They know for 100% sure. In our case, we are just assuming that all patients who come in are a suspected carriers. We're not sure. We don't know how many of them. In fact, India is not even in a phase right now where they can do, increase the number of testing and see how many people are the true carriers. So here you have a benefit of doubt. And like I said, it is like going into a battlefield with an unseen enemy. So if you have the courage to step into the battlefield and do your work, then do it. But if you're so paranoid about, what if you catch an infection, and what is the GSM that I guess in such a scenario, if the mind is having such a battle within yourself, whether it is safe or not, I guess it's safe for such of us to step back and wait for things to, normalize a little bit, get into a new normal mode, and then practice. It's no point working when we're so paranoid about how the scenario outside is.
And one more thing is the aerator, which produces aerosol, and the kind of speed that the aerator produces the aerosol has an increased penetration into the thickness of the material. That's what I read somewhere. So I may be wrong with the units, but I think it is 18 feet what is the contamination area with the aerosol used ultrasonic scaling. So therefore, that also could be one of the reasons why there is a conflict between the kind of GSM that we are using. But I think we shouldn't panic at this moment. Let's wait what is going to be the future of COVID in our country and what is going to be the future of our practice. So let's wait for the government norms and then understand what suits the best. But like Dr. Jitendra said, we wear our mouth mask, we wear our oxygen mask first and then put on the oxygen mask for somebody else. And wonderful job by Dr. Nishant for doing such a work on that. It shows the kind of, passion that you have towards the patient safety and good information as well. Thank you.
Thank you all.
Thanks.
Thank you, doctors and audience, for participating at this discussion. We are actually running out of time, and if you have any queries or any kind of consultations that you want to do with the doctors, you can contact them personally on their website. You have their number. So I hope that this discussion has certainly given immense value and knowledge to our participants. So let's hope all to fight this COVID-19 pandemic situations together. So stay healthy and stay safe. Thank you all.
Thank you.
Thank you, Shailaja. Thank you, everyone, for joining.